Hello and welcome to the Health Bloom channel, where we explore tips for living healthy, joyful, and financially secure in your golden years. Today, on August 11, 2025, we're diving into a crucial topic: the top 3 insurance plans every senior in the US should know. These aren't just any plans, they're your shield against massive healthcare burdens in America. Did you know? According to the latest data from the U.S. Department of Health and Human Services, about 70% of adults who reach age 65 will need long-term services and supports before they pass away, and 48% will require paid care. Medical costs can soar into hundreds of thousands of dollars. For instance, a year in a nursing home averages $131,400. Without preparation, your lifetime savings could vanish in months. But don't worry. In this 20-minute video, I'll break down the top 3 essential insurance plans for seniors in America: Medicare, the foundational government health coverage; Medigap, to fill in those costly gaps; and long-term care insurance, your lifeline for extended care. I'll draw from the most up-to-date 2025 info from reliable sources like the Centers for Medicare and AMP, Medicaid Services and Genworth, giving you accurate details. Why is this video for you? If you're a senior, caring for aging parents, or planning retirement, this is your comprehensive guide to dodging financial pitfalls. We'll cover benefits, eligibility, real costs, enrollment steps, and even real-life examples. If it helps, hit like now and subscribe for more like this. Drop a comment below. What's your biggest healthcare cost worry? Let's jump in and safeguard those golden years. Before we dive deep, here's a quick overview of the top 3, based on recommendations from Medicare.gov and experts. These are the must-haves, covering daily medical needs, insurance gaps, and prolonged care. Medicare, the national health insurance from the government, for those 65 and up or with disabilities. In 2025, about 62.8 million people are enrolled in Parts A and B Medigap, or Medicare Supplement, adds on to Medicare to cover remaining costs like deductibles and coinsurance. Long-term care insurance, or LTC, for non-medical extended care in cases like chronic illnesses, which Medicare doesn't fully cover. Why focus on just these 3? They tackle the biggest senior issues: everyday health expenses, coverage holes, and long-haul support. Now, let's explore each one in detail. Topping the list is Medicare, the core health insurance most American seniors rely on. Managed by CMS, it's divided into 4 main parts: A, B, C, Medicare Advantage, and D. Let's break them down so you get the full picture. First, Part A, hospital insurance. This covers inpatient hospital stays, short-term skilled nursing facility care, up to 100 days, hospice, and some home health services. The big perk: most folks pay no premium if they've paid Social Security taxes for at least 10 years, 40 quarters. But there's a deductible. In 2025, it's $1,676 per benefit period, usually 60 days. After that, coinsurance kicks in for days 6190 at $419 per day, and for lifetime reserve days. Next, Part B, medical insurance. This handles doctor visits, outpatient services, tests, durable medical equipment, and preventive care like cancer screenings or vaccines. The monthly premium for 2025 is $185, up $10.30 from last year, though it could be higher based on income via IRMAA. Deductible: $257 per year, then you pay 20% coinsurance for most services. Part C, Medicare Advantage. This is the upgraded version offered by private companies like UnitedHealthcare or Humana. It includes everything from Parts A and B, plus extras like dental, vision, hearing, and even gym memberships. Benefits: often lower premiums, averaging about $17 per month in 2025, down slightly from 2024. Drawback: you might be limited to the provider's network, with out-of-pocket max around $8,850 yearly. Finally, Part D, prescription drug coverage, focused on lowering costs for prescribed meds. Premiums average around $55 monthly, with deductibles up to $590, though some plans have lower or none. Eligibility for Medicare. Typically at 65 or earlier with disabilities, after 24 months on SSDI or end-stage renal disease. How to enroll. Head to Medicare.gov or call 1-800-MEDICARE during your initial enrollment period, 3 months before to 3 months after your 65th birthday. Real-life example. Imagine Mr. Bob, 68 in Texas, who had a car accident and spent 7 days in the hospital. Thanks to Part A, he only paid the $1,676 deductible instead of $20,000 total. For follow-up doctor visits, Part B covered 80% after his $257 deductible. Without Medicare, he could have gone bankrupt. Pros of Medicare. Broad access, government-backed, serving over 62.8 million in 2025. Cons. No full dental or vision, and gaps like that 20% coinsurance, which is why Medigap is next. Quick comparison table in mind. Part A premium $0 for most, deductible $1,676, covers hospitals. Part B $185 premium, $257 deductible, doctor visits. Part C average $17 premium, varies, all in one with extras. Part D $55 average, $590 max deductible, drugs. Moving on to the second plan, Medigap or Medicare Supplement insurance. This doesn't replace Medicare but complements it, covering gaps like deductibles, coinsurance, and copays left by original Medicare Parts A and B. Medigap offers 10 standardized plans, A, B, D, G, K, L, M, N, F, C, but F and C aren't for new enrollees after 2020. Sold by private insurers like Aetna, benefits are the same across companies. For example, Plan G, the most popular, covers 100% of Part A, B coinsurance, Part A deductible, and foreign travel emergencies, but you still pay the Part B $257 deductible. Costs. Monthly premiums in 2025 range from $100 to $300, depending on age, gender, location, higher in Florida than Texas, and health. Average for Plan G is $164, from $140 to $236. No separate deductible, but premiums rise with age. Eligibility. You need original Medicare, and best to sign up during your 6-month Medigap open enrollment starting the month you turn 65 and get Part B no denials for pre-existing conditions then. Example. Mrs. Linda, 72 in New York, had heart surgery costing $50,000. Medicare paid 80%, but her Medigap Plan N covered the rest, saving her $10,000. A testimonial. Medigap saved me from huge bills. Now I see the doctor worry-free. Compared to Medicare Advantage, Medigap lets you choose any doctor, no networks, but it's pricier and lacks extras like dental. How to buy. Use Medicare.gov to compare quotes from providers. This is a must if you want comprehensive coverage. The final plan. Long-term care insurance, or LTC, for non-medical extended care, like help with eating, bathing, or nursing home stays for conditions like Alzheimer's. Medicare only covers short-term, so Lieutenant Colonel is vital. Benefits. Covers assisted living, average $5,900 $6,077 monthly in 2025, or nursing homes, $10,965 monthly for a private room. You pick 5 years of coverage, daily benefits $100 $400, and inflation protection, 3.5%. Costs. Annual premiums for a 55-year-old single female, $1,500 to $2,855 depending on benefits, couples around $2,600 yearly. Buy in your 50s 60s for lower rates, from companies like Mutual of Omaha. Eligibility. Available to adults 1875, but ideal 50-65, health checks required, no Medicare needed. Stats. 70% of seniors need LTSS, 56% for the 2021-2025 generation. Example: Mr. Tom, 78, needed 3 years of care after a stroke. LTC covered 80%, saving his family $200,000. How to get it? Check Genworth.com. Don't wait, Lieutenant Colonel costs rise 10% annually. In summary, for 2025, Medicare as the base, $185 Part B, Medigap to plug gaps. $100 300 premiums, Lieutenant Colonel for long-term, $1,200 plus yearly. They let you live worry-free. If this helped, like, comment which plan interests you most, share with loved ones, and subscribe now. Thanks, and see you next time. Stay protected.